So when you've got your enema bag, there's a little valve that we're going to open up to fill. But before we do that, we have to clamp the tubing. So you just push that aside, and then that's clamped. We want to turn on our water, and we want it to be warm. We don't want it to be cold or too hot. And let's just say we're going to do a 1,000 milliliter enema. So then you hold your bag, and there's little numbers along the side. This is 500 and this is 1,000. You kind of hold your bag there. So now I'm just going to hook it. And right now, this tubing has no fluid in it. It's just air. So I'm just going to do a quick open. Get that air out of it, and then now it's closed. All of this, can you see that there's fluid in here? There's a little bit of air at the tip. But even though my clamp is way up here, this still will hold the pressure for the fluid in. We just want to verify our patient with our 2 identifiers. If they're able to tell us, that's helpful. Otherwise, we're just going to check their knee bracelet. And then we want to raise the bed to a good working height. So put my gloves on. And then we also want to position our patient onto their left side so that the enema can be administered through the colon properly. So I'm just going to make your bed flat here, Jean. Place my patient onto their left side, and I'm going to cover them with a blanket. So Jane, I'm just going to have you turn on your left side here. So we don't need to overly expose our patient. We can cover them. You're going to have a packet of lubricant, and you can just take your lubricant and you can just squirt it right onto the chucks pad. And then we want our enema bag to be about hip level so that the water or the solution is about at the level of their hip. And there are some holes. There's a hole at the end and on the side, kind of similar to the trach sectioning tube. So we're just going to lubricate this catheter like 4 to 6 inches. Okay. And then we're going to aim toward the client's belly button. So we're going to kind of go up at an angle like this. So Jane, I'm just going to insert the tubing here. Then I'm going to just hold my clamp. I'm kind of holding my patient's body and the tube together so that if they were to roll, it's not going to push or puncture anything. And I don't really want you guys to open the clamps on our mannequins. But you would open the clamp and then let the patient just tolerate the fluid going in. And if they're tolerating it, then you can take your bag and move it up a little higher. If they're having some cramping, then you could just clamp your tube again and just pause for a little time. And then when they're saying that, okay, it's feeling okay, you can move this lower if you want to, or you can just try there again, see how that top is tolerated. Open up the clamp, let the solution go through. When it's all done, or if you see water just trickling down, then it's ready to be done. So, okay, Jane, I'm going to take the tube out, remove the tube. Just going to wipe your bottom a little bit here. Keep this chucks pad. Oops. That chucks pad out. If your patient's able to stay on their side for a little bit longer, that's nice. My patient's going to turn. So you can also use just a little tissue to wipe their bottom. They should try to hold that in for like 5 minutes or a little bit longer if they can. This you just discard. This would just get discarded. Then I would take off my gloves, perform hand hygiene. If my patient was not very aware and I wanted them to be, or even if they're ready for the bedpan, I just want to make sure you guys know how to use a bedpan. So this is a fracture pan. This is where the back would go, and then this is between their legs. So when you're positioning a patient onto a bedpan, you put this right above their sacral area, and then you assist them onto the pan so it's under their hips. So then give them a little bit of time to do their job, and then you come back. When you take them off of a bedpan, you want to make sure the contents don't spill. There is a little handle you can hold, but you're going to assist your patient onto their side. Take out your bedpan with the stool in it. My little tip about using the garbage can as a place to set it. And then you can use some toilet tissue. But then you can use your tissue or your wipes. One wipe to start to get some new tissue. All right, then our patient is clean. Take off the gloves. My patient in a more comfortable position. Lower the head. And I still have the bedpan to deal with, so I would want to put on clean gloves and take care of that, perform hand hygiene when I leave. I also want to show you the Fleet's Enema bottle that we have. So this particular one is a saline enema. Usually the Fleet's enemas are hypertonic solutions. When they come from the pharmacy, this tip is pre-lubricated. So when you remove the cap, it should be shiny and wet looking. Because we've used these in lab for a little while, they're not shiny and lubricated anymore. So if that's the case, you would just use a packet of lubricant and get it moistened around the tip, insert it into the patient's rectum. This is like a vinyl that's really squishy. And when again, I don't want the fluid into the mannequins, but when you're really doing this process, you're just doing a gentle squeeze of the bottle until all that solution is in. Sometimes you can even like roll it a little bit like a tube of toothpaste to try to get all that solution into your patient. Again, if you see that the water is coming out of their bottom, just stop. You don't need to continue to try to get more in because it'll just keep running out. So that's the little difference with that one.